All right, good morning, everybody. We are back with the second half of our interview with Dr. Fawn Cothran over at UC Davis. We are talking mainly about self-care. So for the second half of the conversation, we're going to get more into the kind of nitty-gritty. So Dr. Cothran, thank you so much for joining us again. I'm happy to have you. And to jump into the first question, what are some self-care practices from the research interventions that either you have been a part of or have seen that have been the most effective for you and what you're doing?
Sure. So my work has mainly been focused on qualitative interviews and talking one-on-one with folks and finding out specifically what they do as opposed to testing out interventions. But I can certainly share some of the variety of things that folks have done and that continue to, I advocate for just in my own research. But people do all kinds of things, and massages, mani-pedis, reading a book, going for a walk, playing with pets. It's the important thing about self-care is that it's not always about the traditional, it has to be this long thing or, rigid, if I can use it that way. It really is about those small moments of joy. So what is it that allows you as an individual to take care of yourself? And even if it's 10 minutes, because that's really all you have, or maybe it's an hour, maybe you do have a little block of time, but what are those things that you enjoy? So exercise is obvious, a big piece of it. But it doesn't have to be, this rigorous run 5 miles or 20 miles or whatever it is that, your individual capacity may be. But certainly exercise is important and sleeping is important. All of those things that we know are good for our body are also good for just kind of helping to take care of yourself. I would also add that, one of the things that we don't talk about, and we kind of touched on this a little bit before, is self-care is talking to someone. So yes, it can be your home girl, your boy, it can be whoever. And it can also be a therapist, a professional as well, if that's possible, because it is a lot. And sometimes it is challenging to share some of the feelings and emotions that come with doing this caregiving journey long term. And sometimes people may feel guilty or may feel ashamed of, gosh, I'm angry, or why is this happening, questioning what's going on. And that is okay. And it's helpful to talk to someone about it, so maybe if it's not someone in your family, maybe it's somebody that can be a professional or a friend. But those are the types of things that can be self-care, like really taking care of yourself and just promoting your own well-being, whatever that joy moment is. So that's what I'll say for that.
Right. So, just kind of getting a little bit more, specific. So obviously this series is geared towards younger generations who are taking care of, their aging loved ones. That could be their dad, a grandparent, an older sibling, a close neighbor. And of course they can have, different experiences, like they could be living with type 2 diabetes, they could be living with, traumatic brain injury. My specific question is kind of looking at the unique challenges that, say, family caregivers are facing, specifically caring for a loved one that is living with dementia. How might that be different than other experiences with aging loved ones?
Yeah, so one of the things with dementia caregiving in particular, and you probably know this as well from the research, but dementia caregiving tends to last much longer than many other caregiving trajectories. And a lot of times, especially in our community, we have been caring for someone a long time before, sometimes unfortunately, if you're not aware of what the signs and symptoms are, if someone just attributes it to, oh, well, that's just, them being whatever, or that's always been how they are. Actually, there could have been a change that's been happening. And as a result, this insidious, or, this kind of, it kind of crept in where caregiving began. Mm-hmm. And then if and when there is a diagnosis, that continues with that caregiving journey. And so it's long. That's one of the really unique things about it, at least in comparison to other types of caregiving journeys. But in particular for African American or Black persons, what I've been seeing is that there's a lack of support, and not just support in terms of, whatever the state resources may be, or the local Alzheimer's Association, or whatever local resources are there, but family support. It's really hard for some folks to come to terms with what may be happening for a family member, those changes that happen, and people respond very differently. And if you as a caregiver are kind of assuming that role, or even if you're involuntarily just thrust into that role,
right,
it's hard to get everybody on the same page sometimes, and that can create a variety of different conflicts, whether it's financial, whether it's emotional support, and I've certainly seen that in my work. And so that is a particular challenge, and it's not to take away from just communication challenges that we as individuals probably struggle with anyway, but those family dynamics really can become strained just because of just where people are in their acceptance or denial of what may be happening. So yeah, those are some of the particular things, that those family dynamics which can come into play, as well as the access, as well as just information. Not everybody even knows what dementia is or recognizes some of the symptoms to even ask the question, is this isn't right. So so there are a lot of things that make it challenges, but those are the top three, I guess, that really come to mind in this moment.
No, thank you, Dr. Cothran. I think that sums it up, pretty well, is that it's this sort of ongoing journey. And as I know from the literature, we're seeing that aging loved ones are living longer. And so those who say, live with dementia, it's going to be a longer time caring for them than maybe originally planned.
Sometimes with younger caregivers, they may be dealing with a family member or caring for a family member who is not eligible for some of the common benefits for dementia care, for example. So they have to navigate the system on top of that, because if they have either earlier onset dementia, or they're not at that age bracket to receive some of the resources that are typically set up for older adults sometimes, that creates another challenge, because in addition to whether it's school, whether it's, maybe they're married, now you're trying to navigate a system that even professionals are challenged by. It's not an easy system to navigate. And when you need help, or when you're looking for additional resources, those types of things just continue to add the layers on top. And it's not insurmountable by any means, but it certainly is challenging. And it takes a lot. It really, really does. It takes a lot out of the caregiver in terms of mentally, as well as emotionally, just in terms of it's a lot.
What advice do you have for a younger caregiver just kind of starting out on this journey? And it doesn't matter what their family loved one is, living with, but what do you think are what do you think is some good advice that we can give to those caregivers?
Ask for help. And I don't say that lightly, as someone who is hyper independent, and I recognize that is not the best way to be. I get it. It is hard. And especially if, as we talked about a little earlier, if there are dynamics at play in relationships with family and support systems that don't allow it to become an easy process, as just as simple as ask for help. I don't want to minimize that. And yet, and still, it is important to still ask. Maybe it's about asking for help in terms of, what can that person do? Is that person a financial help? Is that person a come by at noon every day and sit with relative, and you can run an errand or take a walk around the block, or whatever that is? Whatever that is, that support can look like, or that help, take it. And it doesn't have to look perfect. If that person can just do the dishes, if somebody can just do the dishes, ask for that kind of help. If somebody can prepare a meal and drop it by, ask for that kind of help. And not, as we were saying earlier, and not feel like you have to do it all, because you don't. And honestly, you can't. No one can, truly. So I think that's that is my personal plug. Do your best, but please ask for help. There is help out there, and even if it's not family help, I know we mentioned some of the challenges with some of the supports that are available. But if you don't even know that that's an option, then you wouldn't ask for help. But know that there are options beyond or in addition to those family supports. So yeah, absolutely.
Absolutely. Well, I definitely hope that everybody really heard that. And again, just know that as you're starting this journey, it is okay to ask for help. It is okay to give yourself grace, and it is okay to seek resources.
Oh, yeah.
So, Dr. Cothran, I appreciate your time. Before we wrap up, is there anything else that you want to say to the audience watching? Anything, words of wisdom, any of that?
Words of wisdom. Like you, I'm not a caregiver yet as well, but I will just say that we see you. We are out here fighting with and for you, and supporting you, and you are not alone. You are not alone. So thank you so much for this opportunity. I've so enjoyed this.
Thank you so much. I've learned a lot from you, Dr. Cothran, and wish you all the best success in the work that you're doing, because the work that you're doing matters. And so we see you as well. Well, everybody, that completes the second episode. So we hope that this was helpful for you. And as always, thank you for doing something nice for yourself. Bye-bye.
Bye.